What if the medicine keeping your blood pressure under control is the same medicine quietly stealing your energy, your balance, and your independence? Every morning, millions of older adults take their blood pressure pills exactly as prescribed. They trust their doctors. They trust the numbers on their medical charts. But what happens when those numbers look perfect while your body is telling you something is wrong? You feel tired all day. You feel dizzy when you stand up. Your legs feel weaker. Your mind feels slower. And you tell yourself, I guess this is just what happens when you get older. But sometimes it is not aging. Sometimes it is your medication. Today we are going to talk about 3 of the most common blood pressure medications used by millions of people over 65: Amlodipine, Losartan, and Lisinopril. These medications have saved countless lives, and they are important treatments for many patients. But there is something many people are never told. The medication that lowers your blood pressure number may not always be the medication that helps you feel your best. And the difference between those two things could change your quality of life. Meet Margaret. Margaret Chen is 71 years old and lives in Columbus, Ohio. For 6 years, she took Lisinopril every single morning. Her blood pressure readings were excellent. Her doctor was happy, but Margaret was struggling. By noon, she felt lightheaded. By 2 in the afternoon, she had almost no energy left. She could barely sit down and read her favorite novels without falling asleep. She told her daughter, "Maybe I'm just getting old." Her daughter refused to believe that. She convinced Margaret to get a second medical opinion. The new doctor reviewed her records carefully. He did not discover a new disease. He discovered something many older adults never consider. Her medication might no longer be the right fit for her body. After adjusting her treatment, something surprising happened. Within weeks, Margaret felt like she had gotten her energy back. Her story raises an important question. Could your blood pressure medication be affecting the way you feel every day? Here is the first thing every patient should understand. Your doctor usually chooses medication based on medical guidelines, and those guidelines are designed to protect you. However, many of these recommendations come from studies that do not always represent older adults in their late 70s or 80s, who may also take several other medications and whose bodies process drugs differently than they did decades earlier. As we age, our kidneys, blood vessels, and nervous system change. That means a dose that worked perfectly at 55 may feel completely different at 75. This is what I call the perfect number trap. Your blood pressure reading looks great on paper, so everyone assumes everything is working perfectly. But nobody asks the most important question: how do you actually feel? Fatigue, dizziness, brain fog, and balance problems are not always normal signs of aging. Sometimes they are warning signs that your medication needs to be reviewed. Script 15. Number 1. Understanding your blood pressure medication matters. Many people take their medication every day but have no idea how it works inside their body. For example, Amlodipine belongs to a group called calcium channel blockers. It relaxes the muscles around your blood vessels, allowing them to widen and helping blood flow more easily. One common issue with Amlodipine is swelling, especially around the ankles and feet. Losartan belongs to a group called ARBs. It blocks a hormone that causes blood vessels to tighten. By stopping that signal, Losartan helps lower blood pressure and reduces stress on the heart. Lisinopril is an ACE inhibitor. It blocks an enzyme involved in producing a hormone that narrows blood vessels. This helps your vessels relax and lowers blood pressure. Why does this matter? Because these medications do not affect everyone the same way. Each one has different side effects, interactions, and risks. The question you should ask your doctor is simple. Why was this specific medication chosen for me instead of another option? You deserve an answer that is personalized to your health, your age, and your lifestyle. Number 2, the side effect many people are told to ignore. One of the most common complaints from people taking Amlodipine is swollen ankles. Many patients hear, "That's normal, it's harmless." But if your feet and ankles are constantly swollen, it should not simply be ignored. Amlodipine can cause fluid to move into surrounding tissues, creating swelling. For some older adults, this can lead to less movement, more discomfort, difficulty walking, and a higher risk of falls. Your body is giving you information. If a side effect changes the way you live, it deserves attention. The solution may involve adjusting the dose, changing medications, or combining different treatments at lower doses. Never assume that suffering is just part of getting older.